Chelsea Haysworth, and welcome to Georgia News. There's a largely debated issue about whether or not terminally ill patients should be allowed prescription drugs from their doctors to end their lives. This is called euthanasia or assisted suicide, which is the suicide of a patient suffering from incurable disease affected by taking lethal drugs provided by a doctor. To understand this topic more, I sat down with Dr. Calcarez, a cardio doctor from Johns Hopkins Hospital in Baltimore, Maryland.
Washington is one of a few states that has a law allowing terminally ill patients with less than 6 months to live to ask their doctors to prescribe them lethal medication. Even with this law, though, there are many patients that will struggle with non-complying doctors who disagree. Rapid and dramatic developments in medicine and technology have given us the power to save more lives than ever. But at the same time, medicine is given us the power to sustain the lives of patients whose physical and mental capabilities cannot be restored, whose degenerating conditions cannot be reversed, and whose pain cannot be eliminated.
What is your professional opinion?
Terminally ill patients go through many months of pain and suffering. The right to end their life is the same as marriage, procreation, and refusal of treatment.
The doctor gave me insight on why assisted suicide is used and how it helps. There are still many that disagree with euthanasia. No majority ruling has been declared about a patient's right to it. There are also no federal laws on it, but there are acts prohibiting it under homicide laws, which are decided at a state level. To gain insight on the opposing argument, I talked with Mrs. Carpson, the founder of Fight for Every Life organization.
The Fight for Every Life is an organization created to fight against euthanasia. I started this group with my Catholic church in 2009. Our group is focused on creating laws against euthanasia and assisted suicide to prevent abuse and to protect people from unscrupulous doctors and others. Besides religious reasons, it violates the Hippocratic Oath. The prohibition against killing patients such stands as the first promise of self-restraint sworn in by the oath, which says, "I will neither give a deadly drug to anybody if asked for, nor will I make a suggestion to this effect." How do you determine who will end someone's life? There is no line, and there will be cases where non-critical people will abuse this fact to end their life.
These two interviews were quite different, and it was interesting hearing their arguments. We conducted a survey on our website of Georgia opinions on the topic, and of 240,830 people, 72% said assisted suicide should be allowed, while 28% disagree. Email your opinion on euthanasia at haysworthy@georgianews.com. Thank you so much for watching. Until next time, I'm Chelsea Haysworthy, and have a great week.